George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. So glad that we are with our partner, Syracuse Community Health, on a series of conversations that we'll have throughout the year. And this month, we'll be talking with Heather Levy-Scott, the Director of Nursing at Syracuse Community Health. Welcome to the program, Heather. And just tell me, as your role as Director of Nursing at Syracuse Community Health, just what that entails and how does it relate to our topic, which is sexually transmitted infections.
Well, here at the health center, I oversee all the nurses. I work closely with the providers. I work with improving processes, and I am also the infectious disease nurse. So I oversee the infectious disease committee, and any uptake in any disease processes, for instance, flu or COVID or anything that we see in the community. I oversee that, and I report that to our board.
That's wonderful. And so how has your team adapted or responded to recent trends in STI rates in Syracuse and Onondaga County?
Well, what we have done actually is when we see an uptake in the community, all antennas go off. So we make sure we notify all the providers, the staff, and we work closer with the county as to what's happening in the community and how best to approach or to limit the numbers from going up. So we work closer with the county as to our positives cases.
And what are the most prevalent STIs that you're seeing right now?
Well, what we are seeing is that we see chlamydia, gonorrhea, and we have actually just start seeing a spike in syphilis. That's what we're seeing. HIV, not as much, but syphilis has definitely gotten the attention of not just the community health center, but also the county.
And what age groups, neighborhoods, or demographics are experiencing the disproportionate rates of those diseases that you just described?
Well, we can, with chlamydia, we can see anywhere from a 12-year-old all the way up to a 65, 66-year-old patient. It's very concerning that we are seeing such young children having STIs. But we are looking at, how is our teaching? What are we looking at what age do we start to really look at STI in children? And we are also in 8 school bases. So we're now monitoring to see what's going on. So the providers in the school bases are now testing to see, what's really behind the spike in STIs in our children, but also in the community. It's concerning. So we do a lot of teaching when we have patients who come in for testing. We educate. We talk about the different ways to prevent the spread. Talk about the partners. How many partners they've had in the last 12 months, in the last 6 months. Is it something casual? What kind of relationships they're having. Is this a same sex, or is it a male and female? So we talk about all the topics that comes with preventative measures. How to use a condom. We would like to say people should abstain, but we know that's not going to happen. They'll just laugh at us and say no. But that's really the best way to prevent the spread. But it's teaching people how to are the young folks coming in, how to even as simple putting on a condom. What are the preventative measures for not having this kind of infection?
Are the rates higher in our community, Black community? Are we seeing disproportionate impact in our communities?
I would say no. I would say no, because we treat right across the board. So I would say it's equal across the board in male and female patients. So it's not disproportionate at this time. We're not noticing that at this time.
And you also said you're seeing people as young as 12, but the group that that we're seeing some increase with is, in terms of sexually transmitted infections or STIs, is those who are 50 and above. Say more.
Correct. Yes. And that's something that again jumped out as to why is this happening and what are we doing? How can we prevent this from happening? So
Mm-hmm.
when we have our patients in that age group come in, we try to discreetly talk to them about their partners. What kind of relationship is this happening? Is this through a sexual partner? Is this through drug use or sharing needles? We're not quite sure. We haven't narrowed down where it is actually coming from yet. As to say, okay, we can put our finger on the pulse to say this is either from a sex partner, multiple partners, or a casual relationship, or is it a one night? We have not have that our finger on the pulse for that just yet, but we're working towards that.
And is in that demographic, are we seeing more women impacted?
We see women, but surprisingly, we see more men coming forward
Mm-hmm.
for testing than we see
Mm-hmm.
women. We'll see men will come in and say, okay, I've had unprotected relationship last night, 2 nights ago. I notice I'm having pain on urination. I'm seeing some
Yes.
kind of discharge. So then they'll come in and get tested. So we
Yeah.
see a lot more men that are coming in for
Yeah.
that. The thing is, a lot of women will have these infections but don't know
Right.
because
Because
we
I was
don't
gonna.
readily get those symptoms like men will do.
That's what I was gonna ask you, guys. Because I said probably because you're getting that burning sensation.
Correct.
Now you mentioned a connection between sharing needles for drug users, and I
Mhm.
wondered what the connection to STIs was. Yeah.
Well, if you get that the body fluids that
Ah.
can cause, we're talking about exchanging body fluids. So that is something we try to root to discourage people from
Mm-hmm.
sharing needles and again try not to get drunk. Inhibitions goes away when you're drunk or you're using substance. All that goes away. So sometimes when we have patients who come in, they really don't know, what happened because they're either intoxicated or they're on some kind of substance. So that's usually not as easy to pin down when patients come in. And a lot of our patients sometimes really don't want to discuss that because sometimes people are embarrassed that they walk in and they have this infection. And so they're not really willing to talk about, what are they doing, what relationships they're having. And particularly if they're having a same-sex relationship, you usually don't get that, people spilling that out right in an exam room. So again, we have to be very discreet when we're talking to our patients about their relationship. So
Talking with Heather Levy-Scott, Director of Nursing at the Syracuse Community Health. We're talking about sexually transmitted infections and their rate in Onondaga County. And aside from seeing younger people and those 50 and above, for
mhm.
those our listeners, a lot of whom are that, are there other trends you've seen over the last 3 to 5 years in the region that we want to make note of, or that what might be attributing these two particular demographics seeing an increase? And again, the infections we're talking about are chlamydia, syphilis, and gonorrhea, which could lead to diseases if untreated. And I also want to talk about what symptoms, aside from the burning sensation when urinating for men, might one notice. So let's start with trends and then go to
Well,
symptoms.
believe it or not, the trends vary. You may find that like for the last 2 quarters, we see that syphilis just started to increase. And again, trying to put your finger on the pulse as to what's going on. So you'll find that chlamydia may be high while gonorrhea is low. And so they come in trends. We do know that in the summer months, we see more.
Right.
People are out, people are more active, and in the winter months, in the cooler months, you tend to see less. So
Mm-hmm.
that's the kind of trend we're looking at and say people are less active. But again, in the summer months, it's we are expecting to see a lot more of patients coming in to get treated. One thing I want to point out is one of the things we find is that we have repeat customers, repeat patients coming in.
Mm.
Every 2 to 3 months, we'll probably see repeat patients coming in. a lot of teaching is done to say, when you get treated today, you have to wait a period of 7 days before you get active again.
Mm.
That doesn't always sit well with particularly young people, that they
Hmm.
want to wait 7 days, particularly on a weekend. If they come in on a Friday, they don't want to wait. They're like, come on, let's go. So, and that's probably the trend, because and we don't know if people move out of the area, they come back. So it's not as easy to pin down the trend as to the cause, but we do know we have a spike in the summer months as opposed to the cooler months.
Well, obviously, and then what are some of the things I should notice or look for?
Ah, some of the things you need to look for is odor.
Mm.
I'd find that there's a strong odor, the burning, the discolored discharges. Again, it varies depending on what it is, but
Hmm.
you do have a lot of discharge, and the pain on urination is something that you notice. You might have women might be having some kind of bleeding, and it's not their period because there's some infection going on. Again, just having abdominal pain can be one of those symptoms that you're looking for. Our biggest one, particularly for men, is that pain on urination when they're
It's easier for us to track it, right?
right.
Much easier? In terms of stigma, right? Are there barriers to people getting the information and the education? What might those barriers be?
I don't think there are barriers because everyone that comes in, they get the same information.
Hmm.
We follow the CDC guidelines.
Right.
We give them handouts. The providers will go over what are the do's and don'ts and give them materials and all that. So there's really not a barrier for people to come in. I think the barrier is that people may not want to come in because they're embarrassed
You're
to come
right.
in
Right.
to
Well,
to get treated.
how discreet is it, right? I mean,
It's very discreet. You come in. And you just have to say to the when you walk in, I need to see the doctor. We don't ask you to spill to tell us what at the front desk what's going on.
okay.
Only when you get to that room, and you don't have to tell the nurse that comes in or the medical assistant why you're here. You could just say, I just need to speak to the provider. The provider comes in. So all this is done in a room and not outside in the public. So no one should hear what you're saying and can, try to figure out what's going on and all
That's
that. So.
that's really interesting. So I show up at the health center and I say I would like to see a provider. And
Mhm.
then in terms of triage, you don't have to ask me what do I need to see the provider
We
for?
ask what you need to see, what you need to, why you need to be seen. But if you choose not to say because of whatever your case is, we are not going to say we're not going to see you, or we're not going to have you go back to the room. We're going to do your vital signs and we're going to put you in a room, but we're not going to say we're not going to see you because of you're not telling us why you want to be
Interesting.
seen. So.
Right, right. Because everywhere you go in the healthcare system is why are you here? What's bothering you today? Can I, you know what I mean? So to hear that I can avoid that if
Mhm,
I'm shame and feeling a certain kind of way, that's a good thing. So obviously prevention is the key, right?
mhm.
Unprotected sex. One of the concerns that I have that people should be aware of is that STIs are sort of this is what I've learned, and you can help me because you're the infectious disease person. That STIs can be a risk factor for HIV.
It is. It is. So we try to test. Oh, we can't mandate testing for HIV, but we also, a part of the discussion is this is risky behavior, and
Yeah.
if you get this, you can actually you can get HIV.
Right. You up your ante. You up your opportunity
For
for
HIV,
yes, you
for
do.
HIV.
And I wanted to make that clear to folks because you know, a lot of people say, "Oh, just got the clap," and I'm gonna go down and get the shot, right? Because what's the treatment?
We treat people it depends on what they come in. HIV, we have an HIV specialist. So if
Right.
you're positive for HIV, we are going to send you to see our specialist here. Um,
If you have any of the sexually transmitted infections,
You can
what
get Zithromax, Rocephan. Usually those are the two that we give, depending on what you have. You may get both, depending on what your results is, or you may get just one, either Rocephan or Zithromax. So
what
depending on
ha-
what you have.
What happened to penicillin? That was the
Now,
go.
that
That was
is
the
old
go-to
school.
back in the day.
That is back in the day. No, we no longer use that to treat
Really?
STIs. You get one or the other. And again, if you're HIV positive, you get to see the specialist here. We do have a HIV specialist that's here. Not that our providers can't start the process, but we'd like for you to see this specialist to do that. But again, our providers can start the process until you get to see the specialist.
You know what surprised me when you said that communities of color are not at higher risk. So I guess that's an improvement then.
I think so. Yes. Yes.
And
It is.
yeah, and what about the kind of education that we need to do in our youth programs and high schools and our faith-based institutions? Because if you leave it to the faith-based institution, ain't nobody having sex as far as right. But and then also some of our cultural, right? For some faith traditions, you know,
But not only the faith, but you also have to think about when we're talking about treating patients, is that we have to talk about diversity. What
yes.
is my cultural norm? We have in a lot of immigrants. So what is the norm? In certain cultures, it's okay to have multiple partners and it's okay, and not use protection. So
Mm,
when we're talking, we have to also be sensitive to what are the cultures and try to say, okay, this is where we are, and this is how we're going to prevent this. And again, talking about your partners and bringing your partners in.
that,
Interestingly enough, we don't see people coming together with very few people come with their partner.
yeah, no one wants. Well,
Very few
first of
people
all,
come with
you
their
don't want
partner.
you because that'll be the end of that relationship. If well, I shouldn't say that, but you don't want them. You don't want you're embarrassed. You don't want your partner to know.
But
So
that is where we need to try and break that thought process, because if your partner isn't treated and suddenly you decide that you are going to be using protection, then I would want to know what's going on.
yeah,
Then you're going to have a different discussion.
mm-hmm.
But if you don't have your partner or partners treated, you're talking about reinfection. And
Yeah,
earlier I mentioned that we see people come back maybe in 2 or 3 months. If and maybe they don't know where they get it from because they've had multiple partners, or this is a one night stand. We don't know. So this
yeah.
is where all that comes in, is to you have to be open with your partners and let them know. Or maybe we might want to say, drop them a discreet note that, it shows up somewhere and they don't know how it got there. But it's trying to
Well,
let the partners know
well,
that you.
I'm gonna the elephant in the room, Heather, is or it's not the partner that you're supposed to be with. So
Correct, correct. So that's where the problem comes in. And so
right,
um so
you know what I'm
trying
saying?
to get that message out. But
Right,
also when people go to the doctors, it's if you're doing a physical, the doctors are not going to say, no, we're not going to test you,
right,
So if you go in and you can get tested.
yeah.
Come in for a test is totally okay. A part of your physical, part of your routine visit. Can I get tested? And I assure you, the providers here will not say no
Tested for STI, if you
for
mean.
SDIs.
Yeah,
Yes,
yeah, yeah. Because that's not routine, and HIV testing is not routine, but you can ask for it.
you can ask for it.
Yeah,
And
and it,
again, if your provider thinks, or you're talking to your providers about, relationships you have had, they may suggest this is something you want to do. But again, we can't make anyone get tested for HIV. So again, it's almost a willingness to say, okay, I want to know. Um,
thinking about this, I before this interview, we talked about the difference between STIs and STDs. Would you just explain that to me?
okay, so STIs are infections. STD is a disease that the infection can lead to a disease.
Mm-hmm.
So for someone who, for example, have hepatitis B,
Mm-hmm.
and they can pass that on, or they can, if it's not treated, then you're going to end up with disease, maybe liver function problems and all that
Mm-hmm.
stuff. So it's treating the infection with an antibiotic before it gets to the stage of the disease. Syphilis, if left untreated, can go to different stages, and now
Mm.
you have the disease. So you have to be careful, not that you're not waiting too long, or that for women, if you're not treated, can lead to infertility. So one of the reasons we want women to get tested, and for the men to let the women know, especially for childbearing age, this is where we are. So I
So,
need to get tested.
and so, do sexually transmitted infections results from having unprotected sex with someone
Who
who
is
is
infected?
infected? All right.
Correct.
So one of the ways to avoid that is to wear condoms,
Condoms, yes.
right? For that,
Male or female condoms.
right. There's both, and here's the other piece that I'm thinking about as we think about these issues, right? If these rates are going to come down, well, let me ask this: how do you become infected? That's my question.
You have unprotected sex, whether it's
Period.
oral, anal, vaginal. That's how you get it. You have to engage in some sexual activities for this to happen. So if you use condoms, or like I said at the beginning, abstain from this, or limit the number of partners that you have, so you
And,
know.
and I guess what I'm asking more specifically is there some bacteria that like what causes the STI? Is it because somebody's not clean? Or like, is there something that happens that causes somebody to be infected if they're having like? Because here's what I'm asking:
Mm-hmm.
if both of you are clean and and
Mm-hmm.
careful, but you have multiple partners, I'm just trying to play this out. This is not me, Pat, making if you're having multiple partners and everybody's clean and washed up at the same time, can you still get an STD? I guess I'm trying to figure out what's the point of
You have to
infection
have an infected partner.
and
One
how.
person have to be infected. So if you are having a relationship with someone and they don't have the infection, you'll never get it.
Okay,
Somebody has to break the circle. So the chain has to be broken somewhere along the line.
right,
So
and
if the person is not infected, there's no way I can infect you, or they can infect the other person. That doesn't happen.
but
So
but
they have
how.
somebody has to break it.
And I guess what I'm getting to is how does that person get it? Unprotected sex with somebody,
Unprotected sex
and
with
is it
somebody
because
who's infected.
who's infected, but they got infected because how? That's what I'm trying to get to.
Well, these diseases go back hundreds of years. So,
Right,
however it started, but as we are today, um, it doesn't go. It's not a disease that's eradicated.
right.
So the infection is not eradicated. So it's still out there. So it's somebody has it. You can reduce the number of chances. You can reduce the number of infections
Yeah.
in the community by treatment. But if you're not completely treated, so if someone didn't complete, you can get an injection, or you can take the pills. So if someone didn't complete their pills, some of that residual infection is still there.
It,
It's like if you get a UTI as a female, and you do not complete the course of antibiotic and you stop, you're gonna have to restart it again, because the UTI is still there, and it will come back with a vengeance.
yeah.
So
And
it's
yeah, and I want to make it really clear. I'm not advocating for people to have multiple partners and give an excuse for it. I was just trying to understand, how does the person who passes this on get infected in the first place? That's what I was really trying to ask. But the bottom line is we need to make sure that our young people and our elders
are
are
protected.
are protected uh,
Mhm.
and if they're involved in with multiple partners, or even if they aren't, you got to make sure that one of the main ways to do it is to have protection.
Correct. Correct. And we have pamphlets that we hand out. They're discreetly in the room. You don't have to, they're there. So when there's no one there, you can get the information. We can
And you
tell you
give
to.
do you give condoms out as well?
Oh, yes, we do.
Yeah, so I
Yes,
could
we
go.
do. We
I
have those readily available
right.
to in our urgent care, in our departments, in our pediatrics department, in our family medicine department at all our sites. We do have condoms readily available for anyone who requests that.
And we spent most of our time talking about STIs, but in addition to that, obviously you do HIV screening as well, and bodily fluids, sexual activity, sharing of dirty needles are ways in which people pass on HIV infection as well.
Correct.
All right. What is there anything else you want us to know about the prevention of STIs in the Syracuse community?
Syracuse community, we are very discreet. We will welcome anyone. It's non-judgmental. No one is going to be here to judge you. That is taught to all our staff, and I've seen it that no one is judging. There's no one talking. We do not talk about our patients. We do not break HIPAA. So if that's a fear of yours, I can tell you that we will definitely take care of you and be very discreet about your treatment.
I think the bottom line is sexually transmitted infections are 100% preventable. If
100%.
100% preventable. And you can reach out to SyracuseCommunityHealth.org for more steps on what you can do. You can call them and make an appointment. How do they do that, Heather?
Not only can they make an appointment, but they can also do a walk-in.
Walk
Our
in.
urgent care
Yes.
is right here. We're open 6 days a week from Monday to Friday from 8 a.m. to 8 p.m. and on Saturdays from noon until 8 p.m. So you can walk in. You don't need an appointment. But should you want to make an appointment, our number here is 315-476-7921.
They're located at 930 South Salina Street in Syracuse. 930 South Salina Street in Syracuse, right? Get the right address? Yes.
930 South Salina. We also, but our quick care is at 819 South Salina.
That's the walk-in? Is that
That's our walk-in.
819 South Salina Street.
Right. That's where that is. But if they happen to come to our beautiful building at 930, we will definitely see them if they're willing to wait to see one of our providers, or we'll just escort them across to our 819 quick care.
This is great. Heather Levy-Scott is the director of nursing at the Syracuse Community Health. Check them out, SyracuseCommunityHealth.org. You can also walk in at 819 South Salina Street or see them at 930 South Salina Street. We had a great conversation about all the ways that you can prevent sexually transmitted infections and be healthy. That's our goal, is to make you healthy here in the Cuse. Heather, anything else?
I think we've covered everything.
Inspiration for the nation.
Thank you.